Give us a story again of how did it start? Swelling went in first, and then
swelling first, and then little splotches, like brown splotches, came up last night. And then this morning, they were just swollen and like on fire, and this rash just started spreading up my leg.
Gotcha. And you said you had this once before?
Mm-hmm.
Years ago.
5 years ago, yeah.
And it went away. And no fever, chills, nausea, vomiting, diarrhea, no other symptoms.
Mm-hmm.
How about when you pee? Is there like bubbles when you pee?
It's real dark.
It is dark?
Uh-huh.
You haven't been able to go there?
Yeah,
they
got the same.
Okay. So let's get a little closer to the rash and kind of show. What you can see here, obviously a very swollen leg. But what's different about some other swollen legs is there's no pitting edema. Pitting edema means when you push, it stays down. This edema, it doesn't really pit. And then the rash, the way to describe it is purpuric in color, and it doesn't blanch. That's why we know that it's probably micro vessel bleeding underneath the skin. And that's very characteristic of vasculitis. Cellulitis, if you see my other videos, it doesn't have these spots everywhere. It's more like a painting with a spray. It's more uniform. This separated are tiny little bleeding because of the superficial vessels. And the way we know that is because it blanches. If you were a kid with a fever, we would think about sepsis, DIC, which is disseminated intravascular coagulation. We think about meningococcemia, very ITP, which is idiopathic thrombocytopenic purpura, in which the platelets drop and you get bleeding everywhere. But this is just the legs, which makes us think about vasculitis more than anything else. I'm going to go in a little closer here. So you can see here, there's no blanching of the rash. And that's how we know this is vasculitis. So this patient had a normal white count, normal kidney function, but her albumin was a little low, and her CRP was elevated. That's the C-reactive protein was elevated at 1.49, which means this is definitely something inflammatory and definitely a vasculitis. But vasculitis it's a very broad diagnosis. We still haven't defined what kind of vasculitis. So sometimes they'll use blood work or they do a biopsy of the skin to see what kind of vasculitis this is. So we're admitting you to the hospital with diuretics to get rid of some of the edema and steroids to get rid of the swelling and inflammation of the vessels, and we'll see what we find later, right?
My name is Gabby, and I have been doing Restmore for almost a year and a half now, and I'm really persistent on this product. I love it. It has made me so where I just take 2 of them, and in about 30 minutes or so I am relaxed and I can go to sleep very well. It doesn't make me necessarily knocked out and completely drowsy, but it definitely puts my mind and my body in the right state to where I can go to sleep in a relaxed and calm state.